Hello everyone, my name is Agape Estefa, and for my special population project, I decided to focus on the challenges and effects of being a parent to a child with a disability. Also, one of the concerns of families is the financial burden. A recent national U.S. study reported that 40% of families of children with special healthcare needs experience a financial burden due to the child's condition. There is an association between low income and children with special needs. Statistics have shown that children with a disability are often born into low income families. However, it has also been reported that families who care for a child with a disability often find themselves sliding towards poverty. A single income family with lower quality jobs are more likely to live in poorer quality housing and to live in poverty. Furthermore, these families are more likely to be in a single parent household. Having a child with special healthcare needs or disabilities can affect a parent's ability to find and maintain employment, particularly if the child's health impacts the need for flexibility in work schedule. The National Survey of Children with Special Needs Care found that 23% of families in Kansas report that their child's health conditions cause them to cut back both in time and/or pay. Moreover, parents of disabled children require more time off work and are more likely to work reduced hours and decline overtime. The cost of insurance and receiving coverage is also a concern of parents. The combination of the cost of medical care, medication, equipment, and insurance premiums can cause extreme financial hardship for many of the families. The same report done in the Kansas family with a child of disabilities found that approximately 22.1% of Kansas families of CSHCN reported paying $1,000 or more out of pocket in medical expenses in the last year. Approximately 32% of Kansas families of CSHCN report inadequate health care coverage, and 10.7% of families reported having a period of time during the last 12 months where their child was not insured at all. Also, parents face physical and emotional burdens. A study was conducted comparing African American parents of a disabled child with African American peers with non-disabled children and found that they reported more limiting health conditions such as arthritis and diabetes than non-caregivers in older age. Weatherford and colleagues found that the parents of autistic children get sicker too. Specifically, in a 2012 study, found that parents of children with autism were more likely to get common ailments such as colds, coughs, and headaches as a direct result of their increased stresses linked to their caregiving responsibilities. Also, on emotional burdens, some parents have to grieve, some don't want to believe their child's diagnosis and look for several different opinions from different doctors, and it puts a strain on their emotional and mental health. In addition to physical and emotional burden, there's also mental burden that parents face. Elgar and colleagues found that being the mother of a child with mental illness is associated with high levels of distress and depression. In addition, Barkley and colleagues found that mothers of children with mental illness were 2 to 3 times more likely to be depressed than mothers of healthy children. Stress is another big thing that can affect parents, especially parents with a disabled child. Maternal stress is correlated with disruptive behavior as high levels of negative behavior in hyperactive children and children diagnosed with oppositional deficient disorder. Stressed parents are less able to focus on their child and give them the complete attention. Also, parental stress is associated with treatment duration. Parents who are experiencing high levels of stress are more likely to drop out of treatment after a session, especially if the session is extensive and does not appear to be making a difference. As far as predisposed characteristics, some genetics and previous family medical history can play to part of having a child with a disability. Race, gender, age, and geographic location can all be attributing factors, but are not always the cause. For example, a mother in a low socioeconomic area may not have the same access to prenatal care as other expecting mothers, which leads to birth defects in their child. For enabling characteristics, there are not very many other than the behavioral choices a mother may have while pregnant and not getting the needs she may need. For the need characteristics, there are not very many. Previous medical history may lead to a parent having a child with a disability. However, disabilities, whether by birth, accident, or developed, do not discriminate on who they affect or whose life they may change, whether they are the patient or the caregiver. Also, the parent's marriage might be affected by the child's disability. When the parents first receive the news of their child's diagnosis, they may react differently. One partner may need more time to process the situation, more outlets for verbal communication and support, to be more open and direct about their feelings, while another partner may need more privacy about his or her feelings, may not come to an acceptance at the same rate as his or her spouse, or even at all. Some spouses have more positive outlooks, while the others have a harder time moving forward from their pain. Some of the qualities that can be affected in the marriage is self-esteem, spirituality, intimacy, social life, future planning, parenting styles, recreational activities are all things that are affected in a marriage when raising a child with special needs. For the discussion questions, what can be a preventative health tactic for these parents in terms of their health in the future? Also, what are the major challenges parents face with insurance and children with disabilities? And here is a list of all my references and sources.